Hi, today we'll see about retention and relapse in orthodontics. So coming to the definition of retention and relapse. So the definition is given by US. So first one, retention. It's maintaining newly moved tape in position long enough to aid in stabilizing the correction. So relapse means it has been defined as loss of any correction achieved by orthodontic treatment. So why retention is needed? That is the causes for relapse. It is divided into soft tissue factor, supporting tissue factor, occlusal factors, facial growth, and occlusal development. So under soft tissue factor, it's mainly muscular factor. So under supporting tissue factor, reorganization of periodontal fibers and reorganization of gingival fibers. So occlusal factor means tooth size discrepancy, axial inclination of each teeth, transverse discrepancy, and third one. So under facial growth and occlusal development, growth factor and occlusion. So coming to the schools of retention, mainly there are 4 schools of retention. So first one is the occlusal school. Next is apical basal school. Third one is mandibular incisor school. Fourth one is musculature school. So coming to the occlusal school, the occlusal school is given by Kinsley. According to him, the proper occlusion of the teeth is a potent factor in maintaining the stability of the teeth. So at the end of the active orthodontic treatment, there should be proper intercuspation and interdigitation. So there should be cusp to fossa relationship between maxillary and mandibular teeth after the orthodontic treatment. So next is apical basal school given by Lundstrom. So according to him, apical base is one of the most important factor in both correction of occlusion as well as maintenance of correct occlusion. So intercanine and intermolar width should not be altered to prevent the relapse. So NANS advised to increase the arch length only minimal extent. Third one is the mandibular incisor school. It is given by Grieve and Tweed. So in this theory postulate that mandibular incisor should be placed upright over the basal bone. The mandibular incisor should be placed 90 degree to the apical base in order to reduce the relapse. Fourth one is the musculature school of thought. It's given by Roger. So establishing proper function muscle balance is must to achieve stable occlusion. So improper muscle balance lead to relapse. So coming to the theorems of retention. So mainly there are 10 theorem of retention. So 1 to 9 theorem is given by Riedel and 10th theorem is added by Moyes. So coming to the first theorem, teeth has been moved tend to return to their former position. So once the teeth is moved orthodontically, there are chances of return back to its normal position. So second one is elimination of cause of malocclusion will prevent the recurrence. So elimination of the malocclusion is an important factor. For example, in case of tongue thrusting habit, definitely there will be anterior open bite. So if we didn't eliminate the malocclusion and if we are treating only the tongue thrusting habit, if we are treating only the anterior open bite, so after the removal of the appliance or after finishing the treatment, there will be the tongue thrusting habit will not corrected, and after that there is a chance of relapse because once the appliance is removed, patient will start tongue thrusting. So there is a high chance of relapses there. So third theorem is malocclusion should be overcorrected as a safely factor. So the malocclusion should be overcorrected for a safely factor because when we are retracted, when we retract the teeth, try to retract more distally. So if there is any relapse also, it will overlap. Fourth one is proper occlusion is a potent factor on holding the teeth in the correct position. So after the treatment, it's very important that we have to maintain a proper occlusion. So if there is no proper occlusion means a high chance of relapse. So the cusp to fossa relationship is an important factor after orthodontic treatment. So fifth theorem is bone and adjacent tissue must be allowed to reorganize around newly positioned teeth. We need to give some time to time for the teeth to adapt to the newly moved position. So sixth theorem is if the lower incisors are placed upright over the basal bone, they are more likely to remain in good alignment. So the lower incisors should be upright over the basal bone. So in cephalometric, we can tell like 90-degree incline. The tooth should the angulation of the lower incisors should be 90 degrees. So when the teeth is upright over the basal bone, there is less chance of relapse. Next is a correction carried out during the period of growth are less likely to relapse. So when we are correcting, when we are trying to correct the malocclusion in a growing age, so there will be less relapse. So theorem 8, farther the teeth move, less likelihood relapse. So when the teeth is moved more backward, the chances of relapse are less. Ninth theorem, arch form, particularly in mandibular arch, cannot be altered permanently by appliance therapy. So arch form, particularly in the mandibular arch, we should not alter the arch length. Intercanine and intermolar width should not be permanently altered according to ninth theorem. So last theorem is given by Moyes. Many treated malocclusion require permanent retaining device. So many treated malocclusion is required permanent, that is fixed lingual retainer, permanent retaining devices. So coming to the types of retention, mainly we have three types of retention. First one is no retention or natural retention. Second one, limited or short-term retention. Third one is prolonged or permanent retention. So coming to the permanent or semi-permanent retention, cases requiring permanent retention are midline diastema, severe rotation, arch length, arch expansion achieved without ensuring good occlusion, certain class 2 dip 2 cases, patient with abnormal musculature and tongue thrusting habits. So expanded arch in case of cleft palate. So coming to the retainers. Retainers are passive orthodontic appliance that helps in maintaining and stabilizing the position of single tooth or teeth long enough to permit a reorganization of supporting structures. That is after the active phase of orthodontic therapy. So retainers can be classified into removable retainer and fixed retainer. So ideal requirement of retainers. So should be restrain each tooth in its direction of relapse. So it should permit the forces associated with functional activity to act freely on the teeth, permitting them to respond in nearly a physiologic manner as possible. Should be self-cleansing and should permit optimal oral hygiene maintenance. Should be inconspicuous as possible and aesthetic. Should be rigid enough to bear and rigor of day-to-day usage. So coming to the classification of retainers, there are removable retainer and fixed retainer. So coming, the retainers comes under removable retainers are Hawley's retainer, Beck's retainer, clip-on retainer, wraparound retainer, Kessling tooth positioner, and invisible retainers. So under fixed retainers, band and spur fixed retainers, bonded canine to canine retainers, banded canine to canine retainers. So first one is the Hawley's appliance, designed by Charles Hawley in 1920. Most frequently used retainer is Hawley's retainer. So the components are acrylic component. Component support all elements of the appliance. Wire components are Adams clasp, ensure retention of the appliance. Label work provide anterior stabilization, control position of incisor that are meant to move, or loops can be adjusted for the appliance activation. So this is a mostly given retainers that is Hawley's appliance. So it is got two Adams clasp on the molars and the label bow. The label bow will be in the middle of the anti-radial middle portion, and the gauge of the wire is used is 19 gauge. So advantage, it can be used in most cases. Hygiene is not an issue. It can be modified. Disadvantage, susceptible to fracture, require patient compliance. So visible labial bow, interproximal wire may cause opening of the spaces, high incidence of breakage or loss. So in case of all four extraction, if we extracted all the force from force, and if we retracted and we finish the case, we are not supposed to give a Hawley retainer. So the chances of space opening is high in Hawley retainer. So in the four extraction cases, we used to give Beck's retainer or wraparound retainers. So next is a Hawley appliance modification.